what has taken place is a stealth covert repurposing of our health service along the lines of the medical model, sorry, the American model, which is a for-profit system, profit generated primarily through the denial of care. Now, in terms of a democratic deficit, repurposing our health service without a public mandate has to be an even bigger betrayal than what they're trying to do with pushing through assisted suicide. We know we cannot trust our politicians. What they state in the public domain does not reflect their actual political agenda. Assisted suicide is not about being compassionate to terminally ill people. It's about normalizing the killing of the sick, vulnerable, and unprofitable. We already see private interests like private equity funds dominating the provision of nursing home care, yet a third of the money that goes into nursing home care is sucked out as profit rather than adequately rewarding the staff or spending money on employing properly qualified people to look after our vulnerable relatives. The current state of the NHS shows exactly how much our politicians care. We have tens of thousands of people languishing in corridors for more than 12 hours waiting for a bed. We know that 1 in 80 of these people will preventably die as a result of this wait. We have millions, close to 8 million people on waiting lists for elective care. Again, many people will die before this care is provided. Now, where is the urgency to fix these problems that already exist in our repurposed NHS, which has had a capacity cut of 50% over the last 4 decades? We have staff who have had wage suppression. We have a big problem of recruitment and retention, and there is a brain drain of qualified people leaving the NHS because it's endemically dysfunctional. It is a corporate model which is top down, which does not accept dissent or challenge, routinely crushes whistleblowers, and there is not a culture of successful grassroots pressure which determines policy and shaping of service provision. We've seen multiple scandals in the NHS in recent years. We had the mid-staff scandal where they cut staff to meet financial targets. We had the baby P scandal where they employed unqualified or less unsuitably qualified pediatricians to look after the most vulnerable children in society. Now, the lessons of those tragedies were not learned, but actually they've doubled down on the policies that gave us those tragedies. We are seeing an active replacement of qualified staff. Doctors are being replaced by physicians' associates. There is a general dumbing down and de-skilling of health service provision, all driven by the corporate model, which is to generate profits for private companies, particularly American companies such as United Health, which is America's biggest private insurer, which now dominates much of the policy making and behind the scenes reorganizations that have taken place. We saw in the pandemic how the government effectively used behavioral psychology to nudge the population into accepting a loss of their human rights, to accept lockdowns, and to accept mandates and coercions of given therapies that were not administered with informed consent. So we have seen mass breach of normal medical practice. Now, my personal experience is of, in 30 years, only one patient ever asking me whether it would be possible for him to be helped along in his path. The vast majority of my patients who I've seen receiving palliative care have a very comfortable and peaceful passage out of this life. Yet the government continues to paint death as being some horrendous experience, driving fear, and often assisted by celebrities and deliberate television programs which are nudging us, softening us up to accept this desperate policy initiative, which is malign in motivation. Now, we've seen from the experience in Canada that the number of people being euthanized has dramatically increased. And one particular figure that I was horrified to discover is the proportion of deaths that were administered to people who were not terminally ill has dramatically risen. In 2016, the number of deaths for people who were not close to death of natural processes was 463 people were not considered terminally ill, but were given what is called medical assistance in dying in Canada. And the numbers are shooting up. You know, we heard those examples from Dan. Well, there are examples in Canada of people who get into debt, get depressed, and then ask to be euthanized. This is a thin edge of a very dangerous wedge that we are being subjected to. So the culture of the NHS now is to keep your head down, to not show any dissent, and definitely don't whistleblow, otherwise you will be persecuted. So it will be very hard for the conscientious doctor to actually effectively advocate for a patient who he feels vulnerable, who he feels a decision to assist in dying is totally misplaced and wrong-headed, because the culture in the NHS now, in our dysfunctional, overstretched NHS, is just to go along to survive in a career-ending pursuit if you do actually express concerns. So I think we should collectively object to this political betrayal with all the vigor that we can muster. Thank you.
If you like what you saw on the video here, make sure you click on here, because we need to carry on the work we're doing, and the way we do that is through our membership. We'd love you to join. Click on here, see what you can do, and be part of making things better for all of us together. Thank you.